to this audio podcast. This audio podcast is part of the series, the Research and Presentation series, the Research and Presentation series, and this audio podcast as part of a ZtormLabostix production. In this audio podcast, in this presentation today, I look at sort of works from between 2013 and 2014, the peer reviewed and published works in around this was formed or have been formed in around 2015, so late 2014, 2015, and so in this presentation, a sort of a look at the sort of overview of an initiative and sort of a campaign of a sort of collaborative campaign works, an initiative that took place between 2013 and 2014. So this sort of research and presentation overview and this ZtormLabostix Collaborative we'll look at works in regard to blood transfusion and organ transplantation initiative that took place in between 2013 2014 and took part in around the southwest in the United Kingdom. So a little bit of the contents here and what this presentation will include. So there'll be in the contents there's some introduction, a look at sort of aims and objectives in around strategies, and where this the initiative and the sort of campaign, the collaborative works, had 7 main strategies. And so in this content page, you can see hopefully that there is a look at sort of a strategy in around strategy 1 in around education, strategy 2 in around awareness and promotion, strategy 3 looking at science behind blood transfusion and transplantation, and strategy 4 in around the ethics, strategy 5 in around faith and cultural beliefs, strategy 6 in around taking ownership, and strategy 7 in around reporting and reporting and dissemination in around aspects of the initiative and collaborative works. And additionally, listeners and viewers, as part of the contents page, whilst there were strategies, this presentation sort of will look at sort of where the in around the different strategies, the outcomes in amongst the different strategies. So outcomes in regard to strategy 1, and in around strategy 1 around education, the education strategy, in around outcomes in around awareness and promotion strategy, outcomes in around science behind blood transfusion and transplantation strategy, and strategy 3. I look at outcomes in around strategy 4 and the ethics, strategy 4 and the ethics, strategy outcomes in around strategy 5, and looking at faith and cultural beliefs, in around sort of the outcomes in around strategy 6 and taking ownership, and then looking at the outcomes in around strategy 7, and looking at in around reporting and dissemination, and then the presentation. In part, this presentation there will be a look at sort of conclusion. So a little bit of intro to begin. So in around September, just over 10 years ago, just over 10 years ago now at least, in September 2013, a health awareness campaign or initiative commenced in a southwest city in the United Kingdom that was that had that involved that had involved five influential organizations. The campaign followed, or the initiative followed on from an initial meeting that took place at Westminster and Parliament with the all party Parliamentary Kidney Group, the APPKG, at various where the APPKG, and where there were various organizational leads, sort of from various regions or regions around the United Kingdom, and also organizational leads in amongst and across sort of specialties, so to speak. And so, aligned to the health awareness initiative and campaign, they're then at the time the Lord Mayor in the southwest, in the southwest, in the southwest, in a particular city in the southwest, set out to highlight the importance of blood and blood transfusion and organ transplantation, or solid organ transplantation, in amongst ethnic minority communities whom and had been had not been completely aware of how, for example, blood transfusion and solid organ transplants can help save lives. The campaign sort of looked to develop several strategies and outcomes are linked to the following. Number one, in around education. Number two, secondly, sort of awareness and promotion. Three, science behind blood transfusion, solid organ transplantation. Four, in around the ethics. Five, in around faith and cultural beliefs. Six, in around taking ownership. And seven, reporting and dissemination. So the aims and objectives around this were following an official publication of the APPKG and the National Kidney Federation, NKF, in around 2012 manifesto on improving renal transplantation or transplantation services in ethnic minority communities. The campaign on the initiative looked to encourage more from such populations to sign up to the blood transfusion and organ and solid organ transplant registries, or blood transfusion and solid organ transplant registers. The campaign involved collaborative efforts between the following organizations. So there was a main southwest city council, wherein at the time, in around 2013, between 2013 and 14, the Lord Mayor of a particular city in the southwest was had been representing. And then there were organizations such as a multi-faith forum, the Renal Patient Support Group, the RPSG, the National Health Service Blood and Transplant, NHSBT. There was a radio station in the southwest known as Ujima Radio Station, and there was also a radio station known as referred to as BCFM radio stations. Both radio stations representing from the southwest in the United Kingdom. And so the strategies in around the strategies, or sort of before going into a little bit in around the strategy, before delving into the sort of crux, if you like, around the strategies more specifically. The main objectives were to advise on issues advise on issues related to faith and cultural sensitivity, publicize the initiative a campaign within ethnic minority communities, publicize the campaign initiative amongst various faith communities, promote the campaign initiative involving community leaders, assist the community champions in undertaking a role, and support community events and forums. And so, as with many initiatives and campaigns, this collaborative campaign initiative had several strategies, including again, number one, education; number two, awareness and promotion; three, science behind blood transfusion, solid organ transplantation; four, ethics; five, faith and cultural beliefs; six, taking ownership; and seven, reporting and dissemination. So in around education one, so the main strategy in around education in around education and the sort of as part of this initiative and campaign was that there had been a need to increase ethnic minority communities and populations surrounding the understanding around the surrounding the surrounding and the understanding of blood transfusion and solid organ transplant registries. So, as part of this sort of as part of the activities in strategy as part of strategy one and education and strategy one, the activities included broadcasting, web conferencing, workshops, and publications. There was a live debate on blood transfusion and solid organ transplantation on a community radio station, at the time Ujima Radio, with further follow-up interviews in sort of latter part of 2014, in which a healthcare service user, carer, and coordinator from a Southwest NHS trust discussed all of the discussed sort of perspectives and experiences. The Lord Mayor at that time, and collaborators had also been involved in interviews on BCFM on the BCFM radio station in around 2013 and 2014 as part of two different healthcare shows. So as part of the outcomes around strategy one, the initiative and campaign highlighted a need to develop educational packs, for example, to provide information about blood transfusion and solid organ transplantation for ethnic minority communities. These educational packs would include literature and DVDs to encourage community champions to educate on community to encourage community champions to educate on communities on specific topics, and then formal aspects of training would be provided by a trained peer coordinator, and one of the community champions working with Ujima Radio had since been involved in hosting a radio program alongside an advisory panel. The radio program had looked to feature 2 or 3 healthcare service users every month, who will be sort of guests on the radio stations to highlight experiences, sort of lived experiences, and help answer any questions from listeners. This in part did result in on a sort of an ongoing awareness and promotion of the importance of education in blood transfusion and solid organ transplantation in amongst communities. So now looking at strategy 2, awareness and promotion. So the main sort of underpinning, if you like, listeners and viewers, is that the strategy 2 in our strategy 2 and awareness and promotion. So given that there are now novel methodologies or modalities to promote health awareness and education through the internet, for example, these should be investigated and exploited in context of awareness and promotion. And so, as part of the awareness and promotion and sort of the activities as part of strategy two, to the record efforts and promote the campaign initiative. The RPSG invited members of the campaign initiative to campaign of the initiative to complete a 1 month a 1 month diary or journal. Additionally, in 2014, the campaign initiative also looked to address a uh, also look to address it is part of a multi-faith forum health and well-being event. In the same year, in 2014, an awareness day was held at a major shopping center in the southwest in the United Kingdom, in which members of the public or the lay and general public were invited to join were invited to join to were invited to join in discussions, and also where there were opportunities to sign up to the blood transfusion and solid organ transplant the solid organ transplant registers. Campaign initiative collaborators also distributed literature to the public and were available to answer any questions, specific questions about blood transfusion and solid organ transplantation. And so moving forward, with various forms of social media available, with various forms of social media being available, different types should be used or utilized more effectively to enhance people's understanding of the science behind blood transfusion and amongst solid organ transplantation. So this then leads into the outcomes, some of the specific outcomes around strategy two, awareness and promotion. So plans had been organized to provide an online platform, where healthcare service users or patients from various faiths and communities with different illnesses and carers can share lived experiences and methodologies and modalities of developing awareness and promotion included public meetings, blogs and or diaries, working with local radio stations, and using additional sources of mainstream media. And there is or was still need to is or has been still a need to educate lay people on the science behind blood transfusion and solid organ transplantation, whilst ensuring information is accessible and made available in different languages. So now looking at strategy three, the science behind blood transfusion uh, and what science the science behind blood transfusion and solid organ transplantation in our strategy three. So the challenge is to provide, or has been to provide, accessible literature in a variety of languages for patients and carers in multi-faith communities. Additionally, scientists and clinicians also need to interact better with communities to provide effective health education. So in around the activities around the strategy three and the activity, the science behind blood transfusion and solid organ transplantation, in one of the World Kidney Day 2013 e-learning sessions, a physician or consultant nephrologist was invited to present insights on the science behind human organ transplantation. In the same year, in around 2013, a blood tour was organized by NHS Blood and Transplant, the National Health Service Blood and Transplant in the southwest. The event allowed campaign champions to get a better understanding of both the science behind blood transfusion, and additionally, a campaign collaborators were able to get an overview of how to again an overview of how different blood components are quality assured and safely handled before being issued to different centers, different centers across and around the United Kingdom. And so, in regard to the strategy 3 and the outcomes surrounding science behind blood transfusion and solid organ transplantation, so campaign collaborators also discussed the basis for video interviews that aim to provide insight into the workup and preparation of blood transfusion and solid organ transplantation investigations. Secondly, collaborators also discussed basis for routine blood tours for those of all backgrounds and faiths to Europe's largest blood manufacturing and processing center in the southwest United Kingdom. And people who attended the blood tours would also have an opportunity to ask questions about blood transfusion practices and the handling of blood components and the science behind laboratory investigations. Now looking at strategy 4, and strategy 4 being the ethics. So when individuals are planning to go forward with donating blood, for example, or a solid organ, ethics always has a role to play. Health professionals or healthcare professionals should be actively disseminating sort of the facts on solid organ transplantation and blood transfusion processes in communities to ensure information alleviates any concerns and or misconceptions. So in around the activities around strategy 4 and the ethics, so two healthcare professionals were invited to discuss the ethics of solid organ transplantation in around solid organ transplantation during organized webinars in support of World Kidney Day 2013, and during radio interviews had been discussion about what more needs to be done to aid understanding of pathways, and it was evident that the media can play a greater part in the process. Many faiths support the principles of organ transplantation, NHS Blood and Transplant, NHSBT had worked closely with faith leaders to produce a series of leaflets explaining principles, and these leaflets are all accessible and downloadable through NHS Blood and Transplant or NHSBT. So in around the outcomes, the outcomes in around strategy 4 and the ethics. So the organization, one of the collaborating organizations, one of the organizations that was representing in Parliament, in Westminster, as part of the sort of manifesto meeting in early in around 2012, 2013, around that time. One of the organizations known as referred to as the Center for Islam, or CIM, had also been actively prompting ethics courses for healthcare professionals and lay people surrounding blood transfusion and solid organ transplantation. Some CIM events had already taken place in for example in the Midlands and in the northwest of the United Kingdom, and the CM courses had primarily been general practitioner led, and as well as courses dealing with ethical issues facing healthcare service users or patients from different faith backgrounds. There were no plans to introduce. There were no. There have been plans to introduce solid organ transplantation consent questions into medical admissions forms, for example. So a further opportunity as part of the work as part of the sort of the as part of the sort of backdrop, of the works, a further what have been what also had been considered, listeners and viewers, is that a further opportunity may arise when considering the content of the do not attempt to resuscitation or do not attempt a resuscitation form, or the DNA-R form. This process should also initially be a GP-led or general practitioner-led, according to the General Medical Council, or GMC 2013 guidelines, and whether GMC guidelines had informed that where the guidelines inform that the guidelines inform or state that in cases where healthcare professionals or health professionals assess that treatments or route of care is unlikely to be clinically appropriate, they may conclude that cardiopulmonary resuscitation, or CPR, should not be attempted. So some patients with the capacity to make decisions may wish to refuse CPR, or in the case of patients or healthcare service users who lack capacity, it may be judged that attempting CPR would not be of overall advantage. So before the point of where DNA or CPR route becomes inevitable, health professionals and healthcare professionals should consider family consent and ethical issues in regard to patients and wishing to donate organs, and towards the latter part of life, or end of life. So now looking at sort of strategy five, and looking at faith and cultural beliefs. So several investigations inform that attempting to enhance populations' understanding of blood transfusion and solid organ transplantation should also recognize the role of spirituality in community health, and respect faith sensibilities. Additionally, have an appreciation of blood transfusion and solid organ transplantation from the perspective of faith, and in context of community participation. So, as part of the activities, for strategy five, and looking at our faith and cultural beliefs, a campaign liaised with communities from all faiths, in collaboration with five organizations, including NHS Blood and Transplant, BMFF, the Multi Faith Forum, the RPSG, UGMA, and BCFM radio stations. Campaign collaborators look to emphasize the importance of signing up to blood transfusion and solid organ transplant registers, and several members from each community several members from each community signed up to join had signed up to join transfusion blood transfusion registers, and solid organ transplant registers. And in amongst the sort of specific outcomes in around strategy 5 and faith and cultural beliefs, The campaign actively involved those between five organisations, and where the Lord Mayor at that then time at the then time in around 2013 represented the city council at the time, who led events to invite different communities to sign up to blood transfusion and organ and solid organ transplant register. Also, where there was where there were where several events took place at venues such as mosques, temples, and gurdwaras, and interactive events were also organized by the multi-faith forum. And the multi-faith forum made the multi-faith forum magazine, where they had a magazine, had provided a summary of campaign initiative, and had been made available for viewing through the main city council websites. NHS Blood and Transplant, or NHSBT, had also set to having to having a summary of the campaign or initiative on its website. So now looking at strategy 6 and taking ownership. So whilst there is now more evidence of communities becoming more aware of how blood transfusion and solid organ transplantation can help save lives, more regional and national approaches can be adapted to enable practices to become more evidence-based. The Southwest Campaign Initiative was one that addressed the APPKG NKF 2012 manifesto's first call to action point, the need for more members of the ethnic minority groups to take ownership and sign up to blood transfusion and solid organ transplant registers. So as part of the activities and strategy 6 and taking ownership, the introduction of peer and professional educational programs had been planned as part of the initiative or campaign. Members of a community would be provided with training and education, so that they can then share understanding and awareness about the importance of blood transfusion and solid organ transplantation. Peer educators can then either be contracted or accessible through volunteer services. And it had also been put forward to have more training implemented for nursing and medical staff as part of NHS England's continuing professional development CPD plans. Accredited CPD sessions could be based, for example, at the Royal Society of Medicine, RSM, to help healthcare professionals to keep up to date on how to enhance services for individuals from different faiths. The campaign champions had also aimed to maximize use of social media platforms to report and disseminate activities. In around strategy 6 and the outcomes in around taking ownership. So it had been put forward again that the RSM, the Royal Society of Medicine, should have a formal faith and faith and medicine or equality and diversity subsection with CPD accredited sessions, wherein healthcare professionals can learn and present on topics representative of faith and healthcare. The initiative was being discussed. What had been discussed with colleagues at NHS England, where colleagues amongst the collaborators at NHS England, or with NHS England, and the NHS England's Equality and Diversity division. The Equality and Diversity division helps to promote equality and equity, ensuring that healthcare is accessible and that no community or group is hindered. Improvements are made where necessary so that health outcomes across the country are continuously upheld. So at a local level, the Multi Faith Forum is and was aiming to implement educational sessions for healthcare professionals, patients, carers, faith leaders, and teachers with an intrigue in around blood transfusion and solid organ transplantation. So now looking at the strategy 7, reporting and dissemination. So the campaign aimed to implement social media platforms and to disseminate activities through local and regional organizations to see an increase in transfusion and transplantation registries. This strategy involved a formal publication. This strategy also involved a formal publication of the entire initiative and campaign so that it can be replicated regionally and nationally respectively. So as part of the reporting and dissemination and the activities around strategy 7, so to meet the reporting and dissemination objective, the following media initiatives had been projected. So downloadable PDF documents from local radio and collaborators websites. Secondly, a full campaign report and notices about ongoing activities through the Southwest City Council website, collaborator networks, and social media pages. Thirdly, additional publications and presentations available through NHS Blood and Transplant website, and fourthly, a summary of this campaign presented at a European conference for all to learn from and potentially replicate a collaborative approach in other countries. So in part of the outcome strategy 7 and reporting and dissemination, the main campaign or initiative report was forwarded onto the director, the director of the Institute for Health Research within an academic institution based in the United Kingdom, and where the original where one of the original research leads where the original research leads had formed had highlighted the initial aspects and the underpinnings of the of the ini- of the sort of the issues at the initial meeting that took place in Westminster and Parliament in around 2012 as part of the APPKG and NKF manifesto. And in 2014, a summary of the campaign was also presented at the Joint European Society of Pediatric Nephrology (ESPN) and the European Working Group on the Psychosocial Aspects of Children with Chronic Renal Failure, the EUOPA conference, and the presentation was received well, and the co-chair had requested the full report to be made available through the EUOPA website for all to learn from and potentially replicate in other countries. A publication had been formed also from the initiative and the campaign in a peer review journal in around 2015. So now, the sort of conclusion. So during this collaborative initiative and campaign, over 200 signatures for blood transfusion and solid organ transplants have been collated from those across various ethnic minority populations. At the same time, the effort had developed through numerous practical educational activity, most of which involved a high level of participation. And finally, everyone needs to take ownership to ensure that communities are properly represented. That draws this audio podcast to a close. This audio podcast is part of a research and presentation, and this audio podcast as part of a ZtormLabostix production.